Hello, my name is Sailesh Solanki, and I'm the Executive Editor of Asian Media Group, publishers of Eastern Eye and Gauravi Gujarat newspapers. Over the last 2 months, Eastern Eye and Gauravi Gujarat have led the coverage of the coronavirus pandemic and the hugely disproportionate impact the virus is having on BME communities. We have spoken to a whole range of academics, doctors, and other healthcare experts to better understand why this virus is having such an adverse impact on our communities. On Tuesday, 5th May, Eastern Eye secured an exclusive interview with the Secretary of State for Health and Social Care, Matt Hancock. This is an edited video of our interview. Thank you, Secretary of State, for joining us for this interview. So let's begin. Whilst we welcome the review into the high number of COVID infections within BME communities, there is a feeling within these communities that the government has been slow to respond. Given that the review was announced on the 16th of April, why has it taken so long?
We've been learning all the time, and formally announcing the terms of reference and some of the details is another chance to underline the point that we've got to look into why. It's clear from the information that we get back from the data that there is a higher incidence of COVID-19 amongst BME communities and amongst staff with a BME background within the NHS, both amongst the public and the staff. So the work has been underway, and getting these terms of reference out has been an important step, but doesn't take away from the fact that the analysis needs to be done and it needs to be concluded fast and will be before the end of the month.
So onto the review itself. Can you tell us if a terms of reference has been set, who will be on the panel and how long it will take to report?
Well, we'll get the results back before the end of May. Kevin Fenton will lead the report. He's the head of public health in London. When you step back and ask the question, not just how many more people from BME backgrounds are affected by COVID-19, but crucially why and what can we do about it, and what extra is needed, what extra protections, and what is at the root of the problem. I mean, for a start, there is a bigger incidence of disease in urban areas, and we know that there's a correlation between BME populations and urban areas. There's also obviously far more people from a BME background, including people who've come to this country from abroad to serve in the NHS, and from people who were born here. There is a much bigger proportion of people from a BME background in the NHS. And the question we've got to ask is, why is this happening in disproportionate numbers, even over and above what you would expect from the fact that the NHS relies wholeheartedly on people from BME backgrounds in order to function. You know, some of these subjects are sensitive subjects, and we've got to make sure that we get I think just are as open and transparent as possible. And we owe that to those who've already lost their lives to COVID-19.
A GP on the front line said that the PHE had downgraded PPE guidelines for GPs visiting patients at home and care homes. He said that just having a surgical mask, gloves and plastic apron offers no protection, and he has nightmares passing this infection on to his elderly parents and family. So what do you say to people like him?
Well, the PPE guidelines are all clinically led, and they're based on the very best epidemiological evidence and clinical advice. When we brought in the updated PPE guidelines, we did so with the BMA, the Royal Colleges, the Royal College of Nursing, and others. Now, there's no doubt that PPE has been one of the big challenges of this crisis, and there's a global shortage. But those guidelines are very, very carefully drafted according to what the clinical need is.
But he's obviously saying that surgical masks, that they've been offered, the basic surgical masks, gloves, and plastic apron doesn't offer any protection. He's asking for FFP2 and 3 masks and gowns. These are people on the front line who are fathers, brothers, sisters, and sons and daughters. They really do need some reassurance from you that they're going to be protected, because they're putting their lives at risk on the front line.
Yes, absolutely. And it's very important that people have that right level of protection. I've got to take the clinical advice on what the right level of protection is, and then make sure, of course, that we deliver that protection against those standards. So, of course, I can understand people saying that they'd like a higher level of protection, but when the clinical advice says that this is the right level, when there was a large degree of consensus around that, and it's higher than the World Health Organization standards, I thought that was. I think in my position, you have to follow the science on those sorts of judgments.
Some commentators, and you would have probably heard of them, have said that BME doctors and nurses are pushed on the front line because of structural issues within the NHS, and some of them point to racism. There's a BME survey that says that these doctors and nurses are less likely to raise concerns about health and safety. How do you respond to those kind of accusations? Some institutional racism within bodies like the NHS?
Yes, it worries me. I think that I very much hope it isn't the case, and I want to know examples where it is, and I want to encourage people to blow the whistle. I mean, this is it's an issue that I've addressed as health secretary actually before the COVID outbreak, and in fact, I think it was last year, I wrote to every single member of staff within the NHS to say that that you must speak up if you see this happening. Now, I haven't seen any concrete evidence myself during the COVID outbreak where I think that people have really risen to the challenge. So I haven't myself seen evidence of that. I very much hope that it isn't there. But if it is, people should speak up about that.
I think there's a number of surveys which the BMA has done and other bodies have done, which does say that this does exist on the front line.
I'm absolutely not denying it. I'm saying that I haven't seen individual cases, and if I did, I would absolutely act on them.
Okay. So you made it a point to highlight the fact that many of these frontline staff had come from abroad who died. Do you think BME communities and immigrants to this country deserve more recognition and appreciation they have had in the past?
Yes. I think this is something that actually one of the good things that's come out of this crisis. This crisis has had so many bad things come out of it, but one of the good things is that people really value their carers and really understand more, I think, than ever before, that people have come from all around the world to care for all citizens of this country in the NHS and in social care, where there's a very high degree, a very high number of people who migrate here and then work in social care, and how much we rely on people who make that decision and how much we owe to them. So, it is one of the small silver linings that I really think that the British people have woken up to the fact that you cannot run the NHS without people who've come from abroad to make their life here and dedicate it to service in the NHS, and of course without British BME communities who make up such a large proportion of the NHS workforce.
Did you perhaps regret some of the comments made by colleagues from your party during the Brexit debate? The whole tone of the Brexit debate and immigration was actually questioning the contribution of immigrants to this country. I know you were on what didn't make those kind of comments, but do you perhaps regret those kind of comments made by certain colleagues?
Well, I think that, look, it's certainly not something I would ever argue, and I'm very glad that the public debate, I think, has been raised in this area during the outbreak. And so I'd rather put it in the positive light, that I think this is somewhere where, the country has come together and move forward.